is Hugo Mosqueda, and this is my video assessment. First, I just want to do a quick scan. This is my grading rubric. Clean. Back to. I just want you to do a quick scan of the room. This is just drawings. Nothing there. Just scan it over there. This is the calendar. Okay. Alright, so we're going to start with upper extremities. We're going to check for color, a cyanotic, okay, temperature, see warm. We're going to check for texture, condition, okay. And then we're also going to look for tartar, tenting, no tenting, pretty well hydrated. Any lesions pressing, pretty well clean, nothing, no red. Looks good. Okay, so now we're going to look for, inspect the lower extremities. Going to look for the same color, any temperature, cyanotic, color, good. We're going to look for any tartar, hydration. Check for any edema, no pitting edema, comes back. Check the other leg, that's good. Okay. We're also going to look for any varicosities. So we're going to one leg at a time. See that? Bring the leg up. No veins popping. We're going to do the other leg. Let it hang for a little bit. And bring the leg up straight. No veins are pulsating. So it looks good. Alright. See, the hair distribution is pretty even. Okay. No lesions, no redness, no pain, right? Okay. Now we're going to do the nails inspection. Color and capillary refill. Her nails are polished, but if they weren't, we would just check for a capillary refill. Normal would be less than 3 seconds. See the blood return. So we will press. Okay. Condition, thickness, firm, pretty even. Well manicured. No clubbing. Okay. No clubbing of the nails, as you could tell. Let's see if you put these two fingers together like this so we can see a diamond shape. I don't know if you can see that. So it means no clubbing. Okay, good. See a diamond shape. So now we're going to inspect the head. Okay. Size, good. Symmetrical. Shape, normal. We're going to inspect the condition of the scalp. No lesions, no red, nothing there. It's clean. Well taken care. Okay, we're going to palpate the head. Warm, huh? It's good. No warmness. Hair distribution. Doesn't feel coarse. It's good. Okay, quality texture. Paranasal sinuses. Any pain when I press?
No. No.
Okay. Good. No pain, right?
No.
Okay. Now we're going to do temporomandibular joint. Okay, when I press here, see, go like that, up and down. Okay, clench your jaw. Just checking for jaw strength, lateral movement, which you did. Okay, maxillary division, ophthalmic division. We're checking for cranial nerve 5. Very strong. Can you do that again? Let's see. The jaw. Okay, good. Okay. Now we're going to check for cranial nerve 7. Just going to ask you to smile, frown, raise eyebrows, close your eyes, against them to open. Okay, she did that well. Show teeth, puff out cheeks, and purse lips. Okay. Now we're going to move to the eyes, and we're going to discuss the Snellen test. Basically, it's a chart that has letters. You're going to stand 20 feet away, and with one eye covered, you're going to tell me, so each row, there's one letter in the top row, and the letters are going to get smaller. And you're going to make your way down until you can't see it anymore. You're going to tell me, and then you're going to do the same with the other eye, and then with no card, with both eyes uncovered. And basically, if you could see line 20 from 20 feet away, then you have 20/20 vision. And Rosenbaum test, that was testing distant vision. Now we're going to test for close distance vision. is the Rosenbaum test. It's basically the same, but it's going to be like 12 to 14 inches apart. It's a chart with the letters that get smaller, and you're going to cover one eye, and you're going to tell me the same which row you could read it, and then you're going to do the same with the other eye, and then you're going to do with both eyes. And if you could read like row 12 or row 14 from 14 inches, then you have 14 vision. That's the Rosenbaum test. Peripheral vision. Now we're going to hold this, please. Thank you. So now we're going to cover the same eye. I'm covering my left eye, you cover your right eye. And we're going to do peripheral vision. You're going to tell me when you see it.
I see it.
Okay. Now we're going to go from the bottom.
I see it.
Okay, now we're going to go from the top.
I see it.
Okay. Now we're going to go from this side.
I see it.
Okay. Now we're going to do the different eye, the other eye. Okay. Start from here.
I see it.
Okay. Start from the top.
I see it.
Okay. From the bottom.
I see it.
Okay. From the other side.
I see it.
Okay. Good. So that was testing peripheral vision's confrontation. Now we're going to test the cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. We're going to do the 6 cardinal positions of gaze. There you go. This one. Oh, actually, no. This is the H. Okay. So we're going to test your eye movements. Okay. You're going to follow this pen. Follow the pen. Down. Good. Okay. Good. So now we're going to start again. Do the other one. Okay, good. Just look at this. Okay, good. Right. Okay. Good eye movement. That's testing your eye movement. Corneal light reflex. Just gonna see just look at the light, and I can see this eye and the other eye is at the same spot where the light reflex is. Okay, and cover on cover test. So now I just want you to focus on one spot that you can see from over there, and I'm just gonna test your pupils constricting. No, you have to look at the spot over there. Just focus on one spot over there. Okay, so if people do the same, focus on that spot, and I'm checking what the uncovered eye does when I uncover it. The covered eye does when I uncover it. Ready? Okay, the pupils constrict. Okay. So now we're going to inspect eyebrows, eyelashes. Okay, pretty well trimmed, symmetrical. Okay, lid lag. Let me put some gloves on now that I've been inspecting her eyes. It's okay. Okay. Now we're going to inspect her external ocular structures like the eyelids, the cornea, anterior chamber. See. Look up. Good. No redness, nothing, no discharge. It's good. Okay. Lacrimal apparatus, iris, conjunctiva, sclera, position of globe. And we're going to inspect the pupil for response to light, direct and consensual. Pupil formation. We're looking for convergence and constriction of pupils. This one, I believe, is. Forgot that one. Okay, and palpate the lacrimal sac. Any pain there?
No.
No? Okay. Now we're going to inspect the lens for clarity and red reflex. I don't have an ophthalmoscope. I'm going to pretend this is one. I'm going to grab her head, and I'm going to get closer and closer to her. Okay. So by doing that, we're going to inspect a few things. I'm going to get closer. Okay. I'm going to inspect for lens clarity and the red reflex. We're going to look for the optic disc, for size and shape. If there's any hemorrhages, we're going to look for inspect the retinal vessels for color, AV ratio, any arteriovenous crossing characteristics, and inspect the retinal background for color, presence of hemorrhage, exudates. Okay, so we're going to look into all that with the ophthalmoscope as we hold on like that, and we come close to this eye, and then we do the same. We do it for this side too, like this. Okay. Thank you. Okay. We're also going to inspect the macula, fovea centralis, regularity and color. Okay. Now we move into the ears. We're inspecting the auricle and mastoid area. Ears good. Both ears, the mastoid area. No pain, no swelling. It's good. No discharge. Check the other ear for the same. Okay, good. It's okay. Sorry. External meatus and ear canal with the otoscope. Again, I don't have an otoscope. We're gonna pretend this is one. So we're gonna right here. Move this side. Okay. We're gonna pull the pinna here. We're gonna look through here. We're gonna look through the otoscope like that. And we're gonna do the same with the other ear. And what we're gonna look for there is we're gonna look for external meatus and ear canal. Inspect the tympanic membrane. We're looking for the cone of light reflex. Inspect the umbo, malleus, pars tensa, pars flaccida. Okay. So now we're gonna perform the whisper test. I'm just gonna cover one ear and whisper something, and you're gonna repeat. Okay. What did I say?
The weather is hot.
Okay, I'm gonna do here again. Tell me.
The weather is hot.
Okay, good. I'm testing for hearing. Okay. So now we're gonna do the Weber test. The tuning fork on the midline of the head. Here's my tuning fork. Now you're gonna tell me if you hear the sound. Do you hear it?
Yes.
You hear the same on this ear and the
Yes.
same on this ear, both? You don't hear more on one ear or the other, right?
No.
Okay, alright. Now we're going to do the Rhine test. This is, it's going to test for air conduction and bone conduction. So I'm going to hit it and I'm going to put it right. And you're going to count. So with this watch, I'm going to see how, when she's going to tell me when we can't hear it. She can't hear it anymore. You can still hear it?
Okay.
Okay. So now we're going to leave it here right away. It's going to be like 3 to 4 centimeters from her ear. You can still hear it? Okay. The first one was about 16 seconds. Tell me how much long. Tell me when you can't hear it anymore.
Okay.
And this one was about 28. The ratio is pretty accurate. It should be 2 to 1. Air conduction should be more. So it was about 29 seconds. She still heard it when I kept it away from her ear. The bone conduction should be less. And it was like 16 seconds that she heard it. So now we're going to inspect the nose for size. Okay. Shape and symmetry. Symmetrical. Good. Inspect the septum, mucosa, and turbinates. You see, looking for any redness, swelling, no discharge. Good. Okay. And we're going to determine the patency of each nostril. I'm going to press one nose and you're going to... Can you breathe from one nostril? Normal? What
Yes.
about this one?
Yes.
Okay. Test olfaction. Cranial nerve 1. Can you smell it?
Yes.
Okay. Now we're going to inspect lips, buccal mucosa, teeth, gums. Lips symmetrical, no lesions, nothing wrong with the lips. Buccal mucosa. Okay, just look at the gums. Show me your teeth. Okay, good. See, sublingual area. Okay, we're going to inspect for the frenulum. The frenulum, bring your tongue up. It's right there. It's this area right here. It's like a little tendon. Let's see, we're going to look for the Wharton's duct, which should be right under the frenulum right there. And the Stenson's duct should be right there on the side right here. It's hard to see it. It's right there. Okay. Let's see. Inspect the tongue. Let me see your tongue. Stick your tongue out. Say ah. If you look at that bell over there, it's the uvula. The soft palate, the hard palate is on top. Okay. Check the rise of the palate. You did the cranial nerve 9 and the cranial nerve 10. Now we're going to do swallowing, speaking, and gag reflex. Can you swallow? Let me see. Swallow. Okay, there's the gag reflex. So in the back. Okay, inspect the tongue for movement. Cranial nerve 12. Just move your tongue around. Okay. Inspect. Alright, now we're going to move on to the neck. We're going to inspect symmetry. See your neck. Symmetrical. Okay. palpate cervical spinous processes, vertebral muscles. Vertebral muscles in the neck. Okay, any pain?
No.
No swelling.
No.
So now we're going to test for range of motion. Bring your chin down. Bring all the way to the back. Bring your head to the back. To the side. The other side. Okay, good. Very good. So now we're going to test for strength of the cranial nerve 11, spinal accessory. You're going to shrug your shoulders against my resistance. Very good. And now you're going to turn your head from side to side. I'm going to push. You're going to turn it that side. Okay. Now you're going to turn it this side. Okay. Okay. Very good. Alright. That was the sternocleidomastoid muscle. Okay. I'm going to inspect and palpate the trachea now. Okay. Inspection. See. Position and symmetry. Very good. Okay. Very well aligned. Palpate the pre-post auricle nodes. The pre-auricle round. Palpate right here. And the post-auricle node should be back here. Turn your head a little bit. Okay, that's good. Okay, submental around here. The nodes. Submental. Let's see. Sublingual. Submandibular nodes. Should be right there. I forgot. Just do a quick inspection of the room just to show. This is still my my grading rubric that I'm using to go over. Nothing here, nothing here, nothing here. And just inspect that. Go slow. That's just drawings. Go slow. It's just inspecting the room, which I forgot to do. Go slow over there. Just show that. Okay, that's good. Good. Okay. Wait, I'm not done. Don't put your ears. Okay. So now we're gonna. Okay, that was back to the nodes. Palpate the anterior, deep posterior cervical chains. Cervical chains is right here. Okay. Occipital nodes are back here. Turn your head a little. Back here, occipital nodes. Palpate. Okay. And now we're gonna inspect, palpate, and auscultate carotid arteries. Let's see. Feel the carotid right here. Okay. We're going to auscultate with the stethoscope. I can hear it. So now we're going to inspect, palpate, and auscultate the thyroid gland. Let's see. Can you drink something? Just want to so I can feel it better. Swallow. Okay, I felt a little better right there. Feel the trachea too. Okay, let me auscultate the thyroid gland. It takes skills to auscultate. It's very difficult. Should be around there. Okay. And that's the conclusion of my video assessment. Thank you very much.